Okay, we are going to continue the training on Netsmart and Devrel, and we are now on page 4 for proper and effective skill clinician documentation. We are now on page 4. Page 4 is the seizure activity section. If your client had a seizure epilepsy episode during your shift, this is where you document it. This is your flow sheet. Okay, this is the page where you document that. And then you document your time. You document your time. This is where you document your time. And you can document any time that you want. You document your time. If the client did not have any seizure episode or epilepsy during your shift, you don't have to document anything on this page. You don't have to do any documentation on this page. You don't have to document anything on this page. Okay, whatever time, you can document your time. Okay. If there is no epilepsy or seizure episodes for your shift, you don't do anything here on page 4. If the client had a seizure episode or multiple seizure epilepsy episode on your shift, you document each time. And the duration, okay. You document each time and the duration, whether it was 35 seconds, 35 to 40 seconds, okay. Let's say if it was 35 to 40, and then you're gonna put your seconds. Okay. And then was it tonic? Was it clonic? You know, in terms of movement, tonic or clonic. You document. And then postural changes, if there are any postural changes, you know what that is. As a clinician, you can click yes or no, whichever is appropriate for your client. Deviation in terms of eye movement, you can click yes or no. Okay, whatever you have to document here. Are they incontinent of urine or stool? You can document. If there was no incontinence of urine or stool, you don't have to document anything here. If they were not incontinent. If they were incontinent, you can put either fecal or urinary, whichever one. If none, you don't, if there was no incontinence, you don't do anything. Salivation. If there's nothing changed in terms of saliva, you don't have to put anything. If it increase saliva, you want to put that, salivation, if unchanged, they didn't have any increased saliva, then you don't have to put that. Then you can put unchanged or increased. You have to put something here to show. Because in the recovery position, if they have increased saliva, you want to assume, that recovery position, post-ictal phase. Post-ictal phase, if they had increased saliva, you have to assume the recovery position so that they don't aspirate on that saliva, or if they vomited. If they vomited, had emesis, you don't want them to aspirate on that. You have to, post-ictal phase, get them in the recovery position. Consciousness, any loss of consciousness, is they become unconscious, or if it unchanged, if they didn't lose any consciousness, you gotta document something here. Okay? You gotta document something here. The only place you don't have to document anything is for incontinence. If there was no urinary or fecal incontinence, you don't have to document anything. If everything else, you have to click something. You gotta document on their respiration. If there's no change, they were breathing the same, there's no change, apnea, cyanosis, cyanotic, if they turn blue, or other, and then you gotta document. If you click other here in the comment section, you have to document something. What does the other mean? Because any auditor who's doing an audit or anywhere your chart may find itself, they have to be able to read what does that mean, or anything that you couldn't explain here. Okay, if there's no change, you put no change. If they are cyanotic or apneic, whichever one you put. However, you have to put something. You have to put something here. If it's other, you click other and you put what respiration, whatever the respiration was here. You don't do vital signs during that. During an epilepsy episode, seizure episode, you don't do vital signs during, you do vital signs after. And when people are reviewing your chart, like if I'm reviewing your chart, or an auditor who's doing an audit, or wherever your chart may find itself and somebody's reading it, okay? When you put your vital signs in here, it's okay to put your vital sign in here. Let's say BP was 112 or 122 over 76. Or the BP was 122 over 76 or 112 over 76. Okay. And then your respiration, and you see you could put your respiration, what it was. Your respiration was 18 or whatever it was, 18, or your respiration. It has to be greater than 12. It has to be at least 14 if you're an adult. Okay, whatever it is, depending on the age group, okay? Because different age group have their each set of vital signs that are considered normal parameters for that age group. And you have to know the normal vital signs parameters for each age group, whether it's BP, respiration, heart rate, temperature, and then you already know the range for your pulse ox. Okay, let's say it was 14, respiration was at least 14. If it has to be more than 12. Okay. Or otherwise, it's abnormal. We are having what is called respiratory depression or suppression, and you know what can happen with that as clinicians. It's not something that we have to discuss during this training. If you have a respiration that is 12 or less, you know what can happen to a patient. And then, so now we're gonna do temp, but we're gonna do heart rate. Even we get to respiration, we can do heart rate. Okay, we can put the heart rate, we can put whatever you want the heart rate. Okay, whatever you want the heart rate to be. Whatever you want it to be. You can put heart rate 65 if you want, because I kind of like that number. You can put your respiration at least 18, 14 to 18. Usually it's 16, 17, 18, things like that, you know? Because when we're getting into 14, you might even get into 12, which you don't want, depending on the age group. And if it's a toddler, you know, their respiration is going to be higher. It's going to be increased. It's going to be greater than an adult. So you just got to know the different ranges that are normal for each age group, like I said. And if I review the chart and I see anything abnormal for that age group, I will send the chart for correction if I see that. And then for temperature, you got to know what your temperature is. Temperature, you can put 99.0 or whatever, or 98.7 or 98.8, whatever you want it to be. Okay, or 98, whatever, 98, whatever, 98.6, whatever you want it to be. Whatever you, or 98.0, whatever the temperature is. And then you're for your pulse ox, and then you do your documentation. So once you do that here, you see any auditor who's reviewing your chart, you know what you wrote in here. However, I came to realize that if somebody else is reading your chart like myself, or someone who's doing an audit, or wherever your chart may find itself, they're not going to be able to see it because you're not able to expand it to see it. In the comment section, you can expand. The vital sign after post-ictal phase, you cannot expand. Okay? So here in the vital sign section, what you will do is, in the vital sign section, even though you write it to show that you did do your vital sign post-ictal phase, during is always not applicable because you don't do that. You ensure the patient's safety. You ensure that the patient is safe. The environment within the around the patient is safe during a seizure. Your focus is on safety during a seizure for a client. When you intervene, in terms of intervening you don't do vital sign on a patient during a seizure. You ensure their safety. You do vital sign post-ictal phase after, okay? Then you can write in your comment section post-ictal phase. Post-ictal phase. You're gonna write BP, okay, 112 or 122 over 76, or 112 over 76, whichever one it is, or 126. You can write 126 over 76, whatever you want. I like that number 76. And then you can put your heart rate, 65. And then you can put your respiration, 18 or 14, 18. However, we want to see something greater than 14 and 12 because depending on the age group, once you get to 14 and 12, you are getting to respiratory insufficiency. In respiratory insufficiency, as clinicians, you already know what that is, okay? And then for temperature, we can put 98.0, okay, whatever, or 99.0, whatever. And then for your pulse ox, you can put whatever your pulse ox is. Your pulse ox, remember, the normal range, okay? And then if your pulse ox is 98%, 100%, whatever your pulse ox is, you document your pulse ox. Over here, anybody who's reviewing your chart, even though they are not able to see it, once you put it in the vital sign after section here, this is documenting that you really did this post-ictal. This is for your own good. It's showing proper documentation. However, if other people, an auditor or myself who's reviewing the chart, anybody who's doing a chart review, or wherever your chart may find itself, somebody is reviewing it. If they're not able to see it, it's not going to be good. It's not doing any good. So that is why I recommend that you also put that in the comment section so it is clear. And then you can also document here on your pulse ox on room air, okay, 98%, whatever it is. And then you can document about the your recovery position and everything else. Okay, recovery position And then you can document if there was no aspiration and all these good documentation. If there was lethargy, whether it was a mild lethargy, moderate, so whatever you got to document. And then you can copy and paste it in page 7. If you want to copy and paste this in page 7, you can copy it and paste it in page 7, because you also have to do a note, your SM note on page 7. Okay, and then if there's lethargy, you can put mild lethargy. And then if they regain consciousness, you can document that here, mild lethargy. If there's no aspiration, you can clear no aspiration noted. Okay. Aspiration noted. And we don't want them to aspirate, because if they aspirate, you know what aspiration can do. Okay. I can tell you everything aspiration can do. I can. Okay. One of them is aspiration pneumonia. Aspiration pneumonia, you're going to end up in a hospital. You're going to be hospitalized. And it can be fatal if not, if you don't have proper medical intervention, timely intervention, medical intervention, and treatment. Okay, so you don't want to have any kind of aspiration at all. So you can see no aspiration, and then you recovery position. If they are lethargic and it's mild, and then they are able to read, you got document everything that needs to be documented here. Okay, and then you're gonna click on lethargy here. If they are lethargic, if they are alert, if they are verbal, you post-ictal phase, you click all that here. Okay, they can be alert and verbal, okay? They can be alert and verbal and have mild lethargy. However, if they have moderate lethargy, they might be, if they have moderate lethargy, there might be some confusion if it's moderate. Okay, they might be slightly confused if it's moderate lethargy. Okay. And then you're gonna document if it's moderate. If it's severe, they're not gonna be alert at all, and they're not gonna be verbal. They may not even be confused, they might be unresponsive. If it's severe, let's say they had a seizure, a grand mal seizure, and it depends on the duration of that seizure. And that's why some clients have orders for diazepam. Okay. You have to follow your physician's orders. If they become severely lethargic and before they even get to that phase, you want to prevent that before they. However, if your client get to this phase, that would be a 911 call. It shouldn't be, because a seizure episode can also be fatal. You want to prevent that. You're going to follow every doctor orders. You're going to use your clinical skills to prevent. You're going to use all your preventive measures to prevent. You're going to follow all doctors' orders for preventative measures so they don't become unresponsive or lethargic. However, sometimes if you have a grand mal seizure, depending on the duration of that seizure, post-ictal phase, the person will be unresponsive and severely lethargic. That's a 911 call. Okay, even though you might, use your diazepam, whatever, you just use your clinical skills in terms of your clinical response, in terms of your proper, effective nursing intervention and implementation, and following your doctor's physician orders. Sometimes it is something that you cannot control. If a patient has a grand mal seizure and the duration of that seizure, depending the duration, if they become completely unresponsive post-ictal phase and they are severely lethargic. However, a lot of time it doesn't get to that. They are alert and they are verbal. Okay, they have mild lethargy. Mild lethargy. After a seizure, you're going to have some lethargy, even if it's mild. Okay, you're going to have that. If it's mild, that's why I like to put in the comment section whether it's mild, whether it's moderate, for lethargy, and you got to put moderate lethargy, you know, whatever it is, whether it's severe, if there was loss of consciousness, no loss of consciousness, if there were changes of in respiration or no changes in respiration, the skin color, you know, you can document everything in comments. And then to save you time from documenting, you can copy and paste it in your SN notes, in your regular SN notes. And then sometimes, depending on the client and their medical condition, they might have a seizure at different times during your shifts or throughout the day. You got to document that. And after each seizure episode or epilepsy episode, you got to do this documentation for everyone, for every epilepsy seizure episode, and you also got to do your vital signs. Like I said, no one is able to see your vital signs here under vital sign after post-ictal phase. In order for everyone, an auditor or anyone who's reading your chart, wherever your chart, you know, wherever your chart, you know, find itself and somebody's reviewing it, you have to put your vital sign here in comment section so people can see it, your medical interventions, your implementation, your assessment and everything. And then you can copy and paste this in your SN notes on page 7. And that's on page 4. If there was no seizure episodes on page 4, then you don't document anything on page 4. Okay, you don't have to document anything. Okay. And if there's lethargy, and if they lethargy and they're not alert and verbal, sometimes you might have a client who is also nonverbal. They don't speak, and that's their baseline. You just document, you know, that the client is chronically nonverbal. It's not because of the seizure that they are nonverbal. This is something chronic. If they are awake and responsive, you can put awake and responsive and things like that. Whatever is appropriate at that particular time. And if you have any questions, you can always send me a text and we can discuss it. And then you don't have to, in the text, you don't have to really tell me your full name. You don't have to put the full name because of HIPAA. You don't have to give me a full name. You can just send me a text and then we can discuss it, okay? And I thank you for your time. And make sure you save your documentation here, because if you don't save it, then you have to redocument everything again. You want to make sure you click save to document your good work, okay? Your good work, you want to save your good work here. And that's it for this presentation. Thank you.